Hello, in this video we will understand about the systemic lupus erythematosus. It is short SLE for short. It is autoimmune disease mediated by antibodies and immune complexes. So the antigen itself will collapse via antibodies generation, and in this way it is known as the autoimmune disease. Let's begin to understand the all story about the systemic lupus erythematosus. Erythema means the red color, so it means the reddish skin will be appears. That is why it is known as the erythematosus. In this way, it is a common in women of reproductive age, so from 13 to 45 to 50 years, and in this way the rashes will be appear on the skin, and this basically rashes due to the cell damage. So remember, the normal cell will be damaged, and the damaged cell due to the several factors we will discuss also. But this is the damaged cell contain damaged DNA due to the or mutation due to the genetic mutation or epigenetic mutation, which that will lead to cause the SLE. Let's begin to understand these causes. The genetic factors is number one, and the monozygotic twins. Epigenetics. Epigenetics means above of the genes, the acetylation and the methylation. Immunological factors and hormonal factors, as well as environmental factors such as UV radiation, smoking, drugs, and Epstein-Barr virus. Let's understand further. This basically apoptotic cell here, which that is the apoptotic content of the cell after the damage of the cell. An apoptotic cell will produce inflammatory cytokines. We recruit the monocyte to convert macrophage, and in this way, the apoptotic cell phagocytosis will occur for normally. It is normal, but what will be happen for the SLE? So immune response complement proteins, which that will lead to complement opsonization. This complement opsonization, as well as the macrophage is interact with this apoptotic content, but the semi-apoptotic process will occur due to the more and more cell damage continuously, and the genetic deficiency of protein complexes, which that will lead to increased inflammation, and that inflammation will recruit more WBC, the white blood cells, and in this way the increased inflammation will lead to recruit more and more leukocyte, which that will lead to increase the inflammation as a positive response, the positive feedback. In this way, the apoptotic cells not cleared effectively, and in this way, the if will not clear effectively due to the genetic factor as well as other factors, and too much cell will be damaged, will not clear easily. In this way, the immature antigen presenting cell, which that contain toll-like receptor, this toll-like receptor will recognize this antigen and after antigen itself, and in this way the pick up protein via a toll-like receptor, and the increased protein displayed on surface of the apoptotic cell, and it can be a nuclear protein as a antigen, cytoplasmic protein, or cell membrane. Let's begin to understand the nuclear protein. Contain histone protein as a nucleosome, and the double-stranded DNA, VRVP, and Rho, as well as single SSA. While on the other hand, the cytoplasmic proteins contain globulin, enzymatic protein, the globular protein, and the Rho including. While the cell membrane contain a mitochondrial membrane, RBC membrane, and platelets. This is work as an antigen, which that display on the surface of the cells. Let's begin to understand the lymphatic system. So this antigen presenting cell will pick the antigen and through toll-like receptor and will represent through a MSC class 1 molecule. And in this way, it will be show the antigen to the T lymphocyte, naive T cell lymphocyte, will be activate and also produce the cytokines itself. And in this way, the interleukin 4 and interleukin 4 will more and more proliferation of the naive T cell as well as B cell. B cell basically produce the interleukin, recruit through interleukin through antigen presenting cell, interleukin 10 and interleukin 6. In this way, here you can see this is the T helper 2 cell will be formed after the proliferation and maturation and the T helper 1 cell. But the T helper 1 cell will not work more, the promote cell mediated immune response. But on the other hand, estrogen in the female will also recruit the B cell, and in this way also the estrogen is important and promote the humoral immune response and autoantibody mediated immune response. In this way, here you can see this is the plasma cell production after the B naive B cell will be activated to produce B memory cell as well as plasma cell to produce more immunoglobulin antibody. And this antibody will be bind with the Fc receptor of mast cell for allergic reaction as well as here you can see the Bliss and BAF, which that means the basically is the increase B lymphocyte stimulator and B cell activating factor. The SLE 50% of patient increase B lymphocyte stimulator, BL Bliss and B cell activating factor BAF, which that is basically the risk factor is 20 times more common in female than male and 50 to 40 years age. Between the 50 to 40. So this mast cell after the Fc receptor will bind with the Fc portion of the antibodies will lead to recognize the antigen, and in this way the mast cell will be degranulation to produce inflammatory mediators like histamine, and in this way the inflammation will progress more as well as recruit the damaged cell, the phagocytes like macrophage from the monocyte will lead to endocytosis, the phagocytosis, and the autoantibodies basically, which that will lead to immune complex formation as well as it will collapse the cell and will damage the cell more and inflammation will increase more as a positive feed, and the cytokines will produce which that further recruit the monocyte macrophage as well as mast cell, the adaptive and innate immune cells. So in this way the triggered of the damaged cell of SLE flare ups. This flare ups is due to the UV light, surgery and infection progression through bacteria or virus. So remember the trigger of SLE flare up. Flare up means the content of the cell will be left behind, and that flare up. The flare SLE immunologic memory of B cell will lead to produce more plasma cell, and in this way the plasma cell produce more antibodies which that will collapse the other cell due to the flare up memorization. And in this way is sign and symptom we will discuss now. This is the UV sensitive butterfly rash will occur, like a butterfly rash 50%, and the discoid rashes also occur, and the pulmonary interstitial fibrosis and vasculitis. On the other hand, the pleural effusion 40%, and the neurological seizure, psychosis, and the peripheral neuropathy in the brain and nervous system. While the cardiovascular system we will discuss now. The cardiovascular system means that it is the pericardial disease, asymptomatic, or sometimes sometimes feel the chest pain. So in this way, the pericardial disease, the asymptomatic, and sometimes produce chest pain, or the pericardial effusion, the pericardium will filled with the fluid, or the myositis, inflammation in myocytes of heart. On the other hand, the hypertension will increase, as well as the gastrointestinal tract. If we will discuss in this way the hepatomegaly and the pain, as well as the GIT problem, and on the other hand, the renal 30% is the lupus nephritis and renal failure can cause due to the systemic lupus erythematosus. On the other hand, for bones and joints, the arthritis is 90% and the osteoporosis and osteopenia. On the other hand, the hematological is the 50% like anemia and leukopenia. While the let's begin to understand further um, investigation. So, in fact, investigation of the systemic lupus erythematosus, the SLE, is basically the we can diagnose through urine analysis and identification of albumin and creatine. On the other hand, the blood test and the electrolyte and creatine as well as urea in the blood for blood test. We can also identify the urea in the urine. And on the other hand, the antibodies identification, the serum marker. In this, the antibodies, double-stranded DNA antihistone, anti-Rho, etc., which that is as well as anti-nuclear antibodies. We can identify and we can indicate that the SLE presence or absent, and serum markers associated with disease flare-ups and the complement 3 and 4 when decreased, it means the identification, and the anti-double-stranded DNA when increased. On the other hand, the management is vitamin D and calcium as well as reduce the cardiovascular disease and weight loss and quit smoking. Let's begin to understand the summarization, and we will understand about how to inhibit through a drug. This is the antigen presenting cell will represent the antigen as a own self, the antigen which that to the CD4 positive T cell, and interleukin 2 will recruit more CD4 T lymphocyte, and the B cell which that will be recruit also through CD4, and in this way the plasma cell formation to inflammation more, and in this way the cyclosporina will inhibitor of the interleukin 2 and the venetoclax which that and other drugs which it will inhibit the B cell proliferation. So in this video we have discussed about the systemic lupus erythematosus SLE.